making it harder for parents to opt out of routine shots on behalf of their kids. California offers an instructive example of what that could look like for the rest of America. Vaccines fall under the public health jurisdiction of the states, and there's currently a lot of variation across the U.S. when it comes to immunization requirements. All 50 states currently have legislation requiring vaccines for students, but almost every state allows exemptions for people with religious beliefs against immunizations, and 18 states grant philosophical exemptions for those opposed to vaccines because of personal or moral beliefs. The exceptions are Mississippi, California, and West Virginia, which have the strictest vaccine laws in the nation, allowing no philosophical or religious exemptions. States expect that in order to access public resources like schools, camps, or child care centers, individuals must give up some autonomy to make sure everyone in the community is safe, said University of Colorado Denver sociologist Jennifer Reich, who studies the anti-vaccine movement. Perhaps unsurprisingly, the parts of the country that make it easier for people to opt out of their shots tend to have higher rates of people opting out of vaccines, so a lax regulatory environment can create space for more parents to refuse vaccines. Some states have been moving to crack down on this trend, most notably California, and they're already seeing success in terms of boosting vaccine coverage rates. California Governor Jerry Brown signed a controversial bill in 2015 that required almost all school children in the state to be vaccinated, unless they have a medical reason for opting out. The law, SB 277, was a response to a large measles outbreak that originated at the Disneyland theme park, and it means parents can no longer refuse to vaccinate their children for religious or philosophical reasons. Early data from the California State Health Department suggest the law appears to have an impact, even before it went into effect. For the 2015-16 school year, 93% of kids received all of the required vaccinations, up from 90% in 2014 and 2013. Immunization rates in Mississippi and West Virginia, the other two U.S. states with strict opt-out policies, suggest there are real public health benefits to making it harder for parents to refuse vaccines. In the 2014-15 school year, more than 99% of kindergartners in Mississippi had their measles, mumps, rubella, and diphtheria, tetanus, pertussis shots, the highest rate in the U.S. The rates for those vaccines were 98% for kindergartners in West Virginia. These figures are much higher than the national averages, 85% for diphtheria, tetanus, pertussis, and 92% for the measles, mumps, rubella vaccines. So, there's a lot of room for improvement at the state level to toughen up vaccine requirements, even before the U.S. starts considering fines. It's looking like in California, simply closing non-medical exemptions is having a desired effect in terms of boosting vaccine coverage in public schools, Hotez said. Based on that evidence, I think that needs to be the focus. Closing non-medical exemptions in the 18 states that still allow it.